most of the time it's these soft, subtle shifts that all of a sudden you're like, gosh, man, I haven't been able to concentrate for like a month.
Right.
Or I've read that page 5 times. Why can't I remember what I read? Right?
Yes.
Or you're snapping at your kids all of a sudden. You're like, whoa, like I am not usually this snappy. What's going on?
From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. What if your neck pain, brain fog, dizziness, or even anxiety were connected to the way your spine is aligned? Today's guest is Dr. Elizabeth Hoefer, an upper cervical chiropractor and owner of Well-Connected Chiropractic. Dr. Hoefer specializes in the Blair Technique, a highly precise, non-invasive technique that focuses on correcting the top 2 bones in the neck to restore proper nerve function throughout the body. In this episode, we're diving into the neurological effects of spinal alignment, how even small shifts in structure can impact your nervous system, and how this approach to care could be life-changing for people dealing with pain, fatigue, or unexplained symptoms. Let's get into it. Dr. Hoefer, welcome to the Care Experts podcast.
Thank you. I'm so happy to be here.
I'm excited to chat with you today about how chiropractic care can support neurological issues that someone might be having, like anxiety or dizziness, brain fog, a dysregulated nervous system, which is something that a lot of people are talking about these days. So what are some of the symptoms that you see people coming into your clinic with that they may not typically think a chiropractor could help with?
Wow, this is such an important conversation because everything you just mentioned is like what I do day in and day out. And I get to have the privilege of taking care of people that have the more non-traditional presentation. So the vertigo, the dizziness, the ear ringing, the plugged feeling in the ear, people that aren't recovering from, whatever condition that they've been diagnosed with and they're just really struggling. That's oftentimes the kind of people that I get to work with because of the specialized work that I do at the top of the neck.
One of the treatment techniques that you use is called the Blair Technique.
Yes.
Can you tell us a little bit about how that technique in particular supports some of these neurological effects?
Oh my gosh, I would love to talk about that. I have spent my entire career studying this, and I even was blessed to be able to earn a diplomate in the cranial cervical junction. So I'm one of 60 people in the world that have this designation on understanding expert level head, neck, and how the structure of that correlates to the function of the nervous system. So specifically in the Blair Technique, we are looking at the cervical spine, most importantly, the first 2 vertebrae in the neck, the atlas and the axis. But what we're looking at is where those bones meet up with each other. We call it an articulation. So it's where one bone meets another bone. Okay. And so we're looking to see if the articulation is mirror image and matching or if it's slipped. So when we determine that there's a slip on the bone, whether it's under the skull or on top of a vertebra below, we then use our technique without twisting, popping, or cracking to move that vertebra back into alignment, creating structural integrity, which translates to neurological integrity. Because if you understand that the spinal column, the vertebral column, is what's housing our central nervous system and protecting it, you will understand that even a millimeter misalignment can be detrimental to the function of the nervous system. So my job is to analyze and determine where and how that's gone out of alignment, and then gently and precisely put it back into alignment. So the Blair Technique is special because every single body is different, and we use that person's anatomy to engineer corrections specific to them.
This is fascinating and so interesting to really start to connect our body's posture, our alignment to our nervous system well-being.
Yes.
Can we just go back a little bit, do some anatomy 101?
Yeah.
Our nervous system. Yeah. Why is that so important? And how does the spine play a role in nervous system health?
Great question. I often forget that people don't have this like innately understood. It's what I've dedicated my life to.
Yes.
So when people just don't even understand that the nervous system is literally the system that runs the show, if they just had that basic understanding, then they will start to understand the implications on if it's dysregulated and if there's a problem. So you think about somebody that was in a car accident and then all of a sudden they're paralyzed. It's because their spinal cord was injured and their nervous system is affected. Now, that's obviously a very dramatic example of a nervous system dysregulation, but things that are more subtle could be the fact that you don't think clearly. You don't have the ability to remember what you just read. You get fidgety, or you're irritated all the time, or you don't feel good in your own body. Those are soft kind of presentations of a dysregulated nervous system that Blair Technique specifically and generally chiropractic can help with.
So the nervous system is this system that is interwoven through all parts of our body and our mind.
Yeah.
It's impacting all of our organs and
Absolutely.
the function of those organs,
Yes.
including our brain.
Absolutely.
And then it is also impacting our thoughts, our gut health, from my understanding, as well.
So like you said, basic anatomy, we have a central nervous system, which is our brain housed inside of our skull, and our spinal canal, which is housed inside the vertebral canal. So the spinal cord and the brain are the central nervous system. Whenever the nerves that leave the spinal cord and go out of the vertebra, that is called the peripheral. So it's periphery to central, outside of central. And that system connects to every single cell, tissue, organ, and system in the body. So yes, everything you just said is affected by the nervous system. And so a lot of times anxiety will feel like a stomach ache or a migraine, or you get a shoulder tension when you start to get stressed out mentally. This is because it's connected to the nervous system. If we have a dysregulated nervous system and our vagus nerve, that's a big buzzword these days, vagus regulation. If the vagus nerve isn't functioning like it should, all of these things show up and people don't even realize that there's a simple thing to do, which is number one, see a chiropractor.
Yes.
And just having your nervous system evaluated is good so that we can start to determine what is actually causing the problem.
As a chiropractor, when someone comes in and they're explaining all of these symptoms that they have, what are some of the tools that you may use in a session to determine whether or not they need alignment, or do they need something else, like a therapist?
Right. Yeah. That's a great determination. So we have a list of questions and kind of like an intake form that we do to kind of weed out, is this a psychological issue? But the truth is, even the psychological stuff, chiropractic can be effective in helping. It's not like I'm gone to school and become a therapist, but oftentimes I'm helping people recognize their patterns and their thought processes, and recognize that, man, that rumination or that thing that you loop on all the time is because you are stuck because your vagus nerve isn't regulated.
Yes.
So we establish a baseline structural and neurological integrity, and then we oftentimes are, giving them a little bit of counsel, whether it's like, hey, do some deep breaths, or maybe you should go talk to a therapist. And we often refer out for things like that. But tools that I use in the office, back to the question, are things like a leg check, looking at your posture. During orthopedic and neurological examination, it's very clear to me, is this coming from a structural problem, or is this something that I need to get another doctor involved with? I also take three-dimensional x-rays using a cone beam CT and digital x-ray to determine what the structure actually looks like. Dr. Blair is famously quoted as saying, if the misalignment happens at that joint, right there, that articulation, then we should take a picture of the joint to determine how to fix it.
Right.
So it's like very basic understanding of like, if there's a problem in the structure, how about we take a picture of the structure to fix it? Very straightforward.
How would somebody know if they just needed to see a chiropractor who maybe doesn't specialize in the Blair Technique versus needing the Blair Technique?
I find it to be the most comprehensive, especially obviously the neck. And it's just so comprehensive because the brainstem is where everything occurs from. So your brain communicates to the rest of your body through your brainstem. And that's where your heart rate and your breathing and all the centers are that give us life. And so the brain itself is this like cognitive relay center. So information comes in from our body through the brainstem into our cortex, and then our cortex has a movement, and then it goes out through the brainstem to the body. So the ability for me to even move my fingers like this has gone through the top of the neck. And if there's an issue here, all of that can be dysregulated.
Gotcha. Now, when you're doing the technique, you mentioned no cracking, no popping. Are you just using your hands? Like,
Yeah.
what does the actual treatment look like?
It's really interesting. We have you lay on your side so you're in a neutral position, and we'll probably talk about sleep position here in a little while. So everything done neutral position is always a good idea. And we use our hand. So because we've taken the 3-dimensional x-ray, I know what degree the angle is that your joint lives in. So let's say you have a right anterior C2, which means C2, the axis, has slipped forward on C3 on the right side. And let's say that angle is 35 degrees. I'll set my protractor to 35 degrees and I'll move my body to match your joint plane, make an adjustment in a gentle way in a side-lying position with a gentle drop that allows the bone to become corrected and adjusted without any twisting, popping, cracking. And it's so gentle, it's almost like, did you do anything? Because it was so effortless. Because we're doing it in conjunction with that person's anatomy. We're not fighting against it. A lot of times when people have traditional chiropractic, they'll say, oh, just relax or take a deep breath, and they'll do a manipulation. And what I love about the Blair Technique is that it's specific to the individual because it's based on their anatomy.
And is that why it's considered to be so precise and gentle in a way? That it's so fascinating as well when you're working with the body in a way that is more natural, how little force you need.
That's exactly
in order
right.
to bring things back in alignment. And obviously this is true with the Blair Technique and the chiropractic work you're doing, but in many areas of wellness.
That's right. Less is more.
Subtle adjustments and changes that we make.
Yep. And then the idea is to have that hold. So we don't want to have to adjust your neck in a Blair office every single time you come in. The idea is to get that articulation to mirror itself, stay in alignment, and then have the body heal. And so when we have you come in for follow-up visits, the idea is to check to make sure your neck is holding and not have to have an intervention.
Right.
And like you said, over time, stability occurs and that subtle shift will be maintained. But then the bigger shift is that you no longer have stomach aches. You don't have migraines. You don't have anxiety.
Yeah.
It's awesome.
Wow. For somebody who's listening right now, if they are wanting to be a little bit more mindful of their spine and they're realizing maybe even for the first time right now how connected it is to their nervous system and possible other symptoms that they're having, what are just some basics that people can be aware of in order to support optimal health of their spine?
So just sleeping well, like we talked about a minute ago, getting good rest and sleeping in a position that's neutral, either on your back or on your side, so that you don't have a lot of flexion or extension put into your spine. When you sleep on your stomach, we don't have beds that have a cradle for our face like we're in a massage. So oftentimes we're on our tummy and our heads are turned and our arms come up and we sleep kind of like a starfish, right?
Yes.
I advocate using a body pillow to give that support or that awareness and that feedback. But even better, I would say, let's have you sleep on your back or on your side. And the thing is, once you get into alignment, your body naturally, innately wants to be in a good position and be supported. So like if there's a trauma, you trip and fall.
Yes.
Most of the time it's these soft, subtle shifts that all of a sudden you're like, gosh, man, I haven't been able to concentrate for like a month.
Right.
Or I've read that page 5 times. Why can't I remember what I read? Right?
Yes.
Or you're snapping at your kids all of a sudden. You're like, whoa, like I am not usually this snappy. What's going on? Personal story. Last week, it was stressful at the office and busy, and I had just come off 2 different conferences and I was tired.
Of course.
And I just was like in my office crying and I was like, what is going on?
Yes.
I was like, oh my gosh, I think I'm out of alignment. And so I was like, I asked my intern, will you please check me? And sure enough, I was out of alignment. She adjusted me and all was right with the world again. Even for me, who teaches this and lives and breathes it and gets to take care of so many incredible people every day, the minute that I go out of alignment, everything starts to go offline. So,
well, I'm so glad that you shared that personal story because we've all been there where life is challenging at times. And
absolutely.
So there are often times when we will reflect and notice that we feel out of alignment in our life path.
Yes.
And of course, it makes sense to bring yourself back into alignment, there are a number of different ways that we can do this, right? Looking at, am I living in alignment with my values? And is the work that I'm doing fueling me? But starting with your spine,
literally the structure,
center of your body, your nervous system, your mind, this connection point. It just makes so much sense to start there.
That's it. And many people don't even consider, I mean, chiropractic, if you have a headache, if you have back pain, if you've gotten into a car accident. I'm glad that we've penetrated the market to that level, right? But everything else is just as important. And I want the first line of defense to always be, let's go see if we're in alignment structurally, and then we can go from there. I want chiropractic to be the foundation of health that everything else can spring from.
I love that. Thank you so much for joining us on the Care Experts podcast today. It was a pleasure to have you.
It was so fun. Thank you for inviting this conversation. It's an important one to have, and I'm so happy that I got to come.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.